here's the bad news. The number of infections in our county, in our surrounding county, has been rising every day. Every day we have a new number, every day we break the record of number of people who are infected. So I'm pleading with the community, please do not gather, and make sure you follow the public health guidance, because our hospital are now bombarded. The emergency room have no capacity to triage people as quick as they can. We have people who are waiting to be seen when they get to the emergency room. They're wearing the mask, they're staying physically separate from people. That is the only thing that still works to stop the spread of the virus. Let's make that very, very clear. There's no argument on the other side of it. We know why we have an increase in cases in this country. We are now surpassing 16 million people infected and over 300,000 people who die from this virus. Okay? That is a fact. That number is not fake. And the reason why we have an increase in cases is because people were gathering and not following public health guidance. Period. Let's make that very clear. There's no argument on that. Thank you. Sorry, I just have to say that. I am fearful. I lost sleep every night. I'm not going to tell you my personal story, but I am afraid. I have never been so afraid of Christmas and New Year in my life like I have now, because I don't want, I can't imagine what it would be like after the holiday if people are not listening, if people are not compliant, if people are indefiant and get together.
Thank you, Dr. Chau.
Last night, my wife received a text from a dear friend who's a nurse at St. Jude Medical Center. And here's what the text said. St. Jude Medical Center is at 99% capacity. 301 beds are full with 138 COVID patients. ICU is at 105% capacity. They're using every available bed. The emergency department has an overflow area, which is now an inpatient COVID area. All other OC hospitals are in the same situation. It is dire. I think what we're seeing is not a surge, but more like a tsunami, I'm sorry to say.
Our healthcare system can easily get overwhelmed at this point when we run out of capacity. And, when people talk about, well, our death rate is relatively low, but you take a look at what happened in countries like Italy and other parts of the world where their death rate started to go up exponentially when they ran out of space in their hospitals, in their ERs. They ran out of capacity and their healthcare system got overwhelmed. We don't want to get to that point. So whatever we need to continue to do to message out there about the gatherings, I think we really need to help focus on that and drive home that message to the public, because we've got to slow the spread of COVID-19 within our county. Our cases are skyrocketing, and we don't want our healthcare system to get overwhelmed.
Unfortunately, this past weekend, I had to be in the ICU just for personal reasons, and I can tell you from personal observation, every single bed was taken.
Okay. I apologize. I didn't mean to raise my voice, but
you got really emotional today. So. But you know what? I understand that we all are very much concerned about this virus.
If you're not going to wear a mask in a business that requires one, go down the street and find somebody else. Or better, put on the darn mask. If you are a business owner and you want your customers to wear masks so they feel safe, this supervisor, and I certainly expect this sheriff's department and our police departments out there to fully protect your right to control your premises and keep your customers safe. Thank you, Madam Chair.
There are thousands of people who are sitting in the memory care setting here in Orange County. And so we are putting them at risk. We're going to run out of option on how to take care of these people. So
all right, let me finish by saying I know that you are working around the clock, and it has been a yeoman's effort I want to thank you for it, and I will also say for the public, I know you hear the voices of those who come here. I know you hear the voices of the patients, and I know you hear the voices of the medical professionals. I do not envy the position you are in, and I thank you for your continued efforts.